welcome to the October 2025 SHARP session. In these SHARP sessions, we invite speakers to offer information sessions about resources, services, and tools that are available to help English-speaking seniors age in the right place. My name is Erica Botner. I'm the Program Manager for Seniors in the SHARP program at CHSSN. I'm facilitating today's session. Today we have Dr. Boutros with us to discuss how moving more and eating well can help to prevent falls as we age. And we'll share easy practical tips that anyone can use at home to stay active, independent, and safe. It's my pleasure to introduce our speaker, Dr. Guy Haj Boutros. He holds a bachelor's degree in kinesiology and a master's in exercise physiology, where he studied the effects of exercise on metabolic complications in older adults. He completed his doctorate in experimental medicine at McGill University, focusing on the impact of physical inactivity on muscle metabolism. In collaboration with Dr. Jose Moret, who we've had as a guest speaker several times before, he co-founded the SAFE Foundation, which is an initiative dedicated to helping older adults stay active and reduce the risk of falls. And we'll be talking a little bit about this today in the presentation. So I'm going to hand it over now to Dr. Boutros. The floor is yours.
So thank you very much. Thank you, Megan. Thank you, Erica, for inviting me today. It's a pleasure to be here today to discuss about one of the topics that I've been working on for now 13, 14 years. So to start with, I just want to start by a brief introduction. So the title is Resourcing for Staying Active and Preventing Falls at Home. I just want to mention that I have a conflict of interest, as mentioned by Erica. I did co-found the Safe Seniors Adult Exercise Program. And just to give you a little bit of background, so I did undergrad kinesiology, master's physiology, and PhD or doctorate in experimental medicine. And currently, I'm an invited scientist at Vanderbilt University in the United States, which is a new chapter for me. Now, what happens when we age? And this is a very important question. And I think that you have experience with this, especially when we talk about aging as a process that we can actually feel it. We become weaker, we have a slower gait speed, we feel a little bit more tired. Sometimes we have difficulties of doing daily activities compared to when we were younger. And this is something that is a normal process of life. This is normal process of aging. So at some point, every single person, we will get to this stage. Now, does it really need to be exactly the same when we look around and we look at someone in the 70s or 80s and we say, are we all gonna look the same? Are we all gonna be physically inactive or unable to do these tasks? No, the answer is no. There's so many things that we can do to prevent declines, to prevent falls, and of course, to have a healthier and better aging and lifestyle. Now, why are we interested and why do we talk more often about the aging population? The answer is by looking at specific numbers, we can clearly see that we have higher and increasing number of seniors. When we talk about seniors, we talk about population over the age of 65. We clearly can see that the number of people over the age of 65 is increasing. And this is a very good point. Why is that? Because it shows that we are capable of having more and additional years to live. The major problem is if we compare the two years between 2022, 2025, and 2027, we can see that even with this short term, between 2020 and 2007, we can clearly see that there's an increase in lifespan. The problem is we have so much morbidities that is increasing today, and that we have higher lifespan and we live longer, but we don't live healthier. And this is the major problem, is when we live longer, but we don't have a healthy lifestyle and we don't live in a healthy environment and we have so many diseases, it becomes so difficult to be able to maintain it and be able to do daily activities. And this affects a lot of things. So our goal is not just to live longer, but to live healthier. And this is what counts. And this is what is important, is to live healthier. And this gap, if we compare to years 2025, which is today, we can see that the healthy part is even lower and the morbidity is even higher. Now, what are the physiological changes when we age? When we talk about physiological changes when we age, we talk about obesity is part of it. We all gained a little bit of weight when we aged. And this is something that we observe in the Canadian population. We talk about 21% of people over the age of 65 have higher percentage of fat compared to the general population. And what is important is how the fat is distributed. So the fat is distributed in different ways, and we have to avoid having high percentage of fat to avoid other risk of problems that could happen like diabetes, hypertension, and other problematics. In addition, if you look at the figure over here, we can see that in the dark and black here, we have the muscles, and around it, we have the fat. And when we get older, if we compare 40 years old and 70 years old, we can see that there's also fat infiltrated in the muscle that becomes more and more difficult to be able to be mobile and function and have a good muscle mass. Now, there's so many factors that affect obesity. And when we talk about obesity, we talk about the environment. The food today is horrible. We cook less. We always eat out. It's easy to get access to food high in calories. We have genetic factors that also play a major role. We have drugs that sometimes could play a major role. So there's so many factors that could actually affect this increasing risk of obesity. But one of the major factors is that when we get older, we tend to move less, and then we tend to stay more isolated and go less outside. Now, another factor that actually affects our health is bone health. If you look at the left side, which is a younger individual's bone, and the right side, which is an older individual's bone, we can clearly see that there's more holes and it's weaker. Now, what actually happens when we age? When we talk about males, we talk about decrease in bone density in all part of our body. We talk about the whole body, talk about lumbar spine, femoral neck, which is the figure that you have over here, and we have distal forearms. And this decrease is not only observed in males, it's actually observed even into more pronounced and a higher decline in females, and this is due to menopause. After menopause, we tend to see that females lose bone density at a faster rate compared to males. And this is why it's important to always take care of our bone, and I'll explain it later how we can do it. So to increase bone density, I talked about vitamin D, calcium, very important to have these in our daily nutrition. But one of the important thing is to increase bone density, we need mechanical stress. And what is mechanical stress? Is doing resistance training, is lifting weight, is standing up from a chair. This is mechanical stress that can actually improve bone density. So if you have lower bone density, try to stress this bone by walking, taking the stairs, lifting weight. It improves bone density. Now, when we talk about postmenopausal hormones, this is still debatable. It depends on every person. It's very important that if you had a very early menopause, to discuss with your doctor, and this could be an option that can help to reduce bone density at a faster rate, especially if you had a very early menopause. This is something that could affect bone density. Now, genes also affect bone density. If your family history have low bone density or high risk of fracture, this is also another factor that you should consider. But talk to your doctor about this. It might be a great option to be able to use it to improve bone density. One of the things that we talk about is vitamin D and calcium, and they are actually both very important to maintaining a very good bone health. The problem is in today's society is that we try to overtake these vitamins without even knowing what exactly we need. So the goal is to understand what is the need of every individual before start taking these pills or medications or even vitamins, or start focusing on specific type of food that we need. So it's very important to be very individualized and be sure that if you take vitamin D, means that you need this vitamin D. And if you take calcium, means that you need this calcium. Now, in winter, we are less exposed to the sun, especially in Montreal or in Canada in general. And this is why sometimes our doctors recommend to have additional vitamin D, because vitamin D is part of it taken by the exposure to sun. Another major problem is changes in body composition and muscle strength. So if we look, when we compare the figure C and the figure D, if we look at this muscle here, and it is the leg muscle. So this is the femur bone, and this is the leg muscle. You can see that there's more black part here compared to the right image, where there's a lot of white or gray area, and this represents the fat. Now, if you don't change anything in your lifestyle and you just maintain your lifestyle as is, you start losing 0.8% of your muscle mass starting from the age of 40. And this number doubles after the age of 65. So imagine just doing exactly the same thing without changing anything. Even if you go to the groceries, you buy your things, you go back home, you start losing 1.5% of your muscle mass every year. And this is what is very important to focus on and how we can actually reverse it and improve it. Another major problems, and they are all linked together, is that when we get older, we have higher risk of metabolic syndrome. So many people take medication for cholesterol, triglycerides, hypertension, and this also another problem that we observe is diabetes. We have higher risk of diabetes when we get older. So many people take metformin or other kind of medications that could actually improve our diabetes state. Now, if we look at the chronic disease in older adults and we compare it between young and very old adults, we can see that the percentage of people having 4+ diseases is 37% when we get to the age of 80. If we compare it to 45 to 65, we have around 7%. Now, if we want to try to keep it this way, we have to try to change lifestyle. And lifestyle is the major factor to be able to prevent it. So now let's start talking a little bit more about it and how we can actually prevent it. Because lifestyle plays a major role on aging. Of course, biology and whatever you have as genes also plays a major role on aging. We also have chronic diseases that could play autonomy, another problem that also can actually play a major role on aging, and they all are connected that could lead to higher risk of frailty. And frailty is being weak and not be able to move and function normally. When we talk about healthy aging, we try to avoid being into this state, which is the frailty state. And this is why today I'll talk about this lifestyle and how lifestyle habits can actually prevent and improve our health in general. Now, changes is not only when we look at biological. There's the psychological and the social aspect of it that actually decrease when we age. And this is why it is very, very important to not ignore the psychological and the social aspect of it, because both could actually affect the biological aspect of it, which is improving muscle mass, improving the quality of life when we have a good psychological and good social environment. And this could actually affect the biological environment. Now, unfortunately, there's things that we cannot change. And this is not what I want to talk about today. What I want to talk about is the modifiable things that we can do in our life on a daily basis to actually improve our health. So when we get older and older, we have a better quality of life. So of course, age, ethnicity, sex, family history, medication, early menopause, endocrine disease, we cannot change it. But if we look and we focus on things that we can actually improve, we can look at sedentary lifestyle, nutrition, postmenopausal hormones, alcohol, smoking. All of these factors could actually be modifiable and could be a great and a key to successful aging. If we look at just a few points of how behavior we can avoid that can actually improve our health, if we smoke, we have a loss of 10 years of life. If we drink alcohol combined with smoking, we increase it to 15 years of life. And of course, excess weight combined with the first two can actually increase our loss of 20% of life. So we're not talking about year or two. We're not talking about just not being able to walk around or do our daily activity. We're talking about loss of 20 years of life. And if we add to this, just smoking can increase the cardiac disease and stroke, can have pulmonary chronic disease and lung and prostate cancer. In addition to losing lifespan, we're talking here about having problems and difficulties that could add and make our life worsen and more difficult when we get older. When we talk about alcohol, we're talking about max of 15, 20 glasses per week. Sometimes we have high risk of addiction, we have brain and liver damage, and we have falls and car accident, of course, that you can increase this risk. And we talk about excess weight, we talk about osteoarthritis, we talk about arterial hypertension, and we talk about diabetes. So think about all of these things that you can, starting from today, start to decrease and start to increase our health span and being able to improve and think about the longer years that we will actually live. Now, the modifiable factors are physical activity, our healthy eating, our social contacts, sleep, and vaccination. And all of these 5 points I'll be discussing with you today and how each of these points can actually improve your healthy aging. Now, if we talk about the percentage of older adults, and when you talk about older adults, we talk about over the age of 65, we only have 13%, 13% of older adults that actually do the exercise recommended by the World Health Organization, which is around 150 minutes of exercise per week. Only 13. And why is it important? Why this physical activity can actually be beneficial for our health? The first thing, regulates appetite. When we get older, we have less appetite. We have difficulties trying to maintain the calories that we need, trying to eat something that could be sometimes more difficult to chew. But if we exercise, we will actually regulate this appetite and our eating habits will also improve. The second point is it promotes a healthy weight. When you exercise, you tend to have higher muscle mass, you tend to have lower risk of falls, and you tend to have a better weight. And when we talk about healthy weight, we talk about less fat and more muscles. It doesn't need to be on the balance. It could be something that we can change the morphology of our body and not just focus on losing fat or losing weight. We think about converting or switching from more increasing muscle mass and decreasing fat mass. When you talk about reducing body fat is another very important point. So reducing body fat is our goal, is having less fat and increasing muscle mass. Maintaining muscle mass is the major point that I want to talk about. Maintaining muscle mass is the key for all kind of diseases. If you have higher muscle mass, you have low risk of diabetes, you have higher energy expenditure, you have lower risk of falls, you have better quality of life, you have a better walking and gait speed, you have lower risk of cardiovascular disease, you have a better heart. So all of these points are actually improved when we have a better muscle mass and we maintain this muscle mass. Improve heart and respiratory functions. These two are also very important and very crucial to actually have a healthy aging. We also have a reduced stress. Sometimes when we get older, we have higher isolation. We have better sleep when we exercise, and we want to improve it by reducing stress and having an improvement of sleep when we exercise. And all of these points are great and very important points when we talk about using physical activity to have a better aging in the future. Those physically active, we already know. We already studied this, we already know, and we have data on that. They have fewer heart attacks and strokes. They develop less diabetes and obesity. They suffer from less depression and anxiety and insomnia. They have less osteoporosis and fractures. They reduce the risk of some cancers. And of course, they have a higher life expectancy. So again, we're repeating ourselves, but when you exercise, you do not just target one disease, or you do not just improve one aspect of the detrimental changes that we observe with aging. We are actually touching and trying to improve our overall health and not just one point. Now, most people ask me, Guy, it's easy to understand that exercise is something that we can do and it improves our health even before starting the presentation. I'm pretty sure that if I asked you, does exercise improve your health, and does it prevent diabetes? Does it improve your muscle mass? Does it improve your stress? You're all going to raise your hand. You're going to say, Guy, you're saying something that we already know. So we don't need to repeat ourselves and say that exercise is something that improves our health. The problem is, how do we do it? The problem is when we get to a certain age, we're not sure what we can do. We have fear of exercising. We have fear of falling. Does it really improve our health? Is short and small daily sessions could actually improve our health? What is exercise? Is it going to the gym? Do we really need to go to the gym? No. What I want to tell you today is that exercise is as easy as standing up from a chair, is as easy as taking the stairs if possible, is as easy as walking around the block. So small and short daily sessions of slow running, and if you can't run, walk, of a very slow pace can reduce your overall mortality by 20%. 20% is reduced by just doing a very slow running activity. When I ask you about brushing your teeth, or when I ask you about doing an everyday task, this is how exercise could be implemented in your daily life. When you avoid this and when you don't do this on a daily basis, this is where it becomes more difficult to be able to observe these benefits. So what I suggest is start by doing very slow walking daily sessions. If you can increase the intensity, go ahead and do it, but intensity is relative to every person. The second thing is you have 40% of cardiovascular mortality within 3 years. So if you start from today, start walking around the block, just doing very slow running or even just a very slow walking, you can actually reduce 40% of your cardiovascular mortality within the next 3 years. We have higher total brain volume, equivalent to approximately 1.2 to 2.2 years less brain aging. And let's be honest, everyone wants to keep their brain healthy. Everyone wants to avoid any of the neurodegenerative diseases that could actually happen when we age. We talk about Alzheimer, we talk about Parkinson, and we don't want to have a very poor brain. We want a healthy brain. And just by doing this every day on a daily basis, you will actually increase the brain volume. And we have so many masters athletes that they participate in some of our studies, and they are in the top 5% of their respective age category at an international competition. And what I want to tell you is that these people in this figure here, in this image here, they didn't actually start exercising when they were 20. Some of them started exercises when they were 60, 70, 55. So there's no age to start exercising, and there's no age to actually start saying, okay, I'm going to start because if I start today, tomorrow will be better. And this is the major problem, is that some people start and they get discouraged, thinking that they cannot improve. You have to be patient. You have to be patient by doing it on a daily basis with a very, very small dose. Polypharma is a major problem in our society today, and I think that it is not mentioned by doctors. One of the major problems is that doctors usually just say, oh, exercise, but they don't give any tips. They don't know how to do it. They don't know how exactly they should be doing this. And I think that this is something that we need to start more and more often to explain how important it is to do baby steps. So you mentioned about fear of falling or dizziness when we stand up, and this is why it's important to start by baby steps. When we do, like, let's say if you feel uncomfortable standing up, Do it with the walker next to you, do it with someone, a caregiver next to you, do it with a healthcare professional next to you. Start by doing these baby steps. And I think that doctors should start having more and more, I would say, courses on how important is exercise and nutrition in a healthy aging. Because today, as you mentioned, they just prescribe medication without knowing that pharma is one of the major problems of falls, of other problems that could be caused, and how exercise can actually reduce all of these factors at the same time. So I think that it is a major problem. Start by baby steps. Now with our Safe Seniors, now we started the foundation. The Safe Seniors Foundation is actually starting to implement these exercises by giving training to the residents and people, the caregivers that works at the residence. And this is why our goal is to try as much as possible to raise awareness on how we can do exercise in a proper way with avoidance of falling and improving the fear of moving. Tips to get started, I'll give you some tips. Walk regularly. Start slow. Do it by increment of 10 minutes. As easy as slow as 10 minutes as the pace that you think is good for you. If you can take the steps, take the steps. If you can actually walk longer duration, do it longer duration. The second thing is do more what you normally do. So every activity counts. It's getting groceries, household, gardening, walking the dog. All of these points are very important, and do not underestimate how important are these points. If you still do it, keep doing it and add to it. Activity that can be social. Social is very important. Look for group of activities or classes. These are the best thing that you can do. And this is what we did with the SAFE program. We offer the SAFE program in a group and could be individual, but in a group, this is where we observe that people adhere to it at a higher rate and we have less dropout. So if you have a community, if you can go to classes and do exercise in a specific community, just go there and do it. Do it with your family, with your friends. Try to be active by being social at the same time. More tips, try something new. When you try something new, at first, it's going to be hard. It's going to be difficult. But there's so many classes of yoga or Tai Chi that are adapted to your level. And it's not just going and doing stretching. It's more adapted and it's feasible. It's not feasible. And we have so many YMCAs that does this. And try something new is always good to the brain too. So when you do something new, you do not only improve your muscle and strength and balance, but you also improve your overall quality by improving also the brain. Try practicing your balance. If you use a walker or you use a cane, try practicing your balance and coordination by doing very easy exercises, just standing up from a chair. If you can stand up from a chair, do it 3-4 times a day. Do it at least 4 or 5 times if you can do it, and try to work on your balance. So always make sure that it's in a security environment so you're not gonna fall. It's secure, and you can do it sometimes if you have more difficulties with balance. You can do it with someone that is around just to make sure that if anything happen or there's a fall, they can be of help. We also have for people that are at risk of falls. So if we have people here listening that have a higher risk of falls, or they have fallen within in the last year, they can actually use our website, which is the Safe Senior website, safeseniors.com. And you have all the exercises that you can actually follow the video and do the exactly same thing. Of course, it's very important to make sure that it is safe to do it for you, but usually this safe exercise program is adapted and do the exercises that you can do. In addition, there's so many things that I will talk about it at the end of the presentation that you can use as tips, recommendations, and frequently asked questions. But the most important thing is that it's for free. You don't pay anything, you just go on the website and then you can use it. Now, another thing that I want to talk about is how important to increase the intensity. So let's say when we talk about vigorous exercise can actually just in 5-10 minutes can be as good as 30 or 40 minutes of exercise at a lower intensity rate. So what is vigorous exercise? Vigorous exercise is an exercise that you can do at a higher pace, and it's your pace. And how do you know that it is a vigorous exercise when you do? A very easy point to do is if you're able to talk while doing this exercise, it means that it's not vigorous enough. Usually you are short breath. So you're talking this way and you have difficulty breathing, it means that you are setting this bar to the vigorous bar for your level. And this is why this is another recommendation, is that doing vigorous exercise will actually improve your overall health faster than doing a moderate exercise intensity. So adapt it to your pace. Do not follow everyone's pace, because everyone have their own pace. And this is why it's important to use this technique of being short of breath is a good point of exercising.
You were talking about vigorous activity and knowing that it's vigorous when you're a little bit out of breath, but how do you know if it's too out of breath? You know, like how much is
Yeah.
the right amount of out of breath?
That's a very, very good question. One of the things that we do know that people are always afraid of increasing the intensity, and
Hmm.
afraid because something might happen. What we do
Hmm.
know is that if there's no restrictions from your medical doctor, or if anyone said that, you have a disease or something that could worsen the situation, this is definitely something that you have to avoid. But if there is no restrictions of doing exercise, there's no limit. If you can push it, go ahead and push it. So don't be afraid of increasing the intensity. It's actually the opposite. The more you increase the intensity, the better it is. There's even a study done on over 17,000 participants that had a heart attack, and they asked them to do a high intensity training. Of course, it's relative to their intent, to their condition, and 99% of the group, which is a huge group, improved their heart health after doing the HIIT training. And there was zero incidents that happened due to the HIIT training. So what I always suggest is try to increase it as much as possible. There's some evidence to suggest that I think it was 80% or 90% of people after the age of 30 doesn't sprint anymore. And I always say, like, at least do it once a week. If you can increase your intensity, I'm not saying to sprint, I'm just saying that be short of breath by doing an exercise. It's definitely good for your health. And don't be afraid. This is what I would say.
Okay.
Another factor of changing lifestyle, and this is a very, very interesting study. When you change your lifestyle, it's even stronger than taking the medication if we want to look at indices of diabetes. So I don't know if some of you are taking the metformin medication. So metformin here is a medication for diabetes, and they compared three groups where they followed them over 4 years, and they looked at lifestyle is even better than taking metformin to improve diabetes if we do it over 4 years. So I'm not saying stop taking your metformin. I'm just saying that you can increase your lifestyle, and this way you can decrease your risk of diabetes and improve your diabetes state better than the medication for diabetes. So this is another point that is important. And imagine this is only looking at the diabetes state. By increasing and improving your lifestyle, you're not only focusing on diabetes, you're focusing on all other aspects that I mentioned earlier during the presentation. And if we compare and we get back to the same image that I showed you at the beginning, where this young individual of 24 years have this much muscle, and we compare it to the right image, which is, again, the black area is the muscle mass, we can clearly see that at the age of 66, we have less muscle mass and we have more fat mass. So lean mass here is muscle mass. This individual have around 13 kilogram of lean mass, which is muscle mass, and this participant or individual have 57 kilograms. So they have around 40 kilograms of difference. Now, this individual here only does 3,000 steps per day. Now, if we take another individual that does 12,000 steps per day, and he's the same age, around the same weight, we can clearly see that muscle mass is maintained in this figure and then in this MRI image compared to this individual. So these two individuals have the same age, around the same weight, but this individual on the right have around 20 kilograms of muscle mass more than the person that only does 3,000 steps per day. So increasing your steps, this is a great indicator of increasing muscle mass.
Like, what's the difference between resistance training and strength training, or is there resistance training on the SAFE
Yeah.
website?
So I'll talk about resistance training as a training. So I'm just gonna explain what is resistance training first for the audience. So resistance training is technically lifting weights. So any kind of weights that you lift, let's say if you do this movement, if you stand up from a chair, is a resistance training. So technically just pushing against a resistance, which could be your body or could be an external resistance. This is by far one of the most important exercises and type of exercises that can actually prevent falls and improve muscle mass. If you do resistance training and you do it 2, 3 times a week, and you combine this with good proteins, you can actually increase your muscle mass at any age. Even if we talk about 70, 80, even 90 years of age, if you do this, you will increase your muscle mass and you will improve your mobility and you will have less risk of falls. So resistance training is one of the best that you can do. It could be just as easy as standing up from a chair, or if you know someone, or if you have a kinesiologist or someone that can actually help you in a gym that have some experience, just go ahead and use this resource, because resistance training is the key of increasing muscle mass when we age. I recommend all kind of exercises as long as it makes you feel good, it doesn't hurt when you do the exercises, and of course, when you do it, you can maintain it. Don't do something that you do today and then you stop tomorrow. Try to do something that you can maintain it on the long term. Now, we did discuss exercise. Now let's discuss about healthy eating. Talk about healthy eating. We talk about the diet that we have on a daily basis. And this is the Canadian Dietary Guidelines. You can access this website. It's online, it's for free, and you can get as much tips as you want. And I took a few screenshots from this website just to talk about the healthy eating recommendations, and I'll give you more tips once I go through this. So it is a heavy slide. I just want you to look at specific points, which is be mindful of your eating habits. So take the time to eat, notice when you are hungry and when you are full. Sometimes we tend to eat really fast, especially younger individuals. Cook more often. Plan what you eat. Sometimes if we are in a residence, it's a little bit more difficult. But if you have the capacity of cooking, plan what you eat. Involve others in planning and preparing meals. This helps a lot. When you are in a group, you usually plan and you involve these people, you increase the social activity and enjoy your food. Culture and food traditions can be part of healthy eating, and I'll talk about it more in the next few slides. We also need to eat plenty of vegetables and fruits. Very important. Very, very important. And of course, the protein is another very major problem, that when we get older, we tend to eat less protein. Limit highly processed food. Another very important point. And of course, make water your drink of choice. Water is very, very important. And most of the time when we get older, we have higher risk of dehydration. So we do not have this capacity compared to younger individuals to know exactly when we are thirsty. So try to always be hydrated and drink water as much as possible. And I want to give you an example of a great diet. And I never ever suggest to follow a specific diet. What I suggest is to follow a diet that you like, a diet that is rich in fiber and fruits and vegetables and in protein and good fat. So when we talk about in large quantities, I'll give you a few tips. Lots of fresh and fruits and vegetables and many varied cereals and legumes. Very important to increase your fibers intake. Very, very important. On a daily, it's very important to eat walnuts, hazelnuts, almonds, and olive oil. Another very important aspect of preventing increasing high risk of disease, if you eat olive oils, if you eat good oils, like walnut, hazelnut, almond, and olive oil, you decrease dementia, you decrease risk of Alzheimer. And of course, in moderate quantity, it's very important to eat fish, which is another very important source of protein, but good fat. Various yogurts and cheese, they are rich in protein, and of course, spices and aromatic herbs, and a little bit of red wine. I always say, if you like red wine, it's very rich in antioxidant. You can actually grab a glass of wine, which is actually good, but you have to be very moderate, because glass of wine Sometimes we talk about red wine, focus on the red wine because it's very rich in antioxidant compared to the white one, but it's a great source of antioxidant. But if you take it into with a higher dose, if you take 2 glasses, 3 glasses per day, it becomes more dangerous. Now, tips on healthy diet and maintaining muscle mass. Of course, it's very important to increase protein intake. And some people think protein is always meat or chicken. You can actually have so much protein in plant protein, which is chickpeas, oat, tofu, quinoa, lentils, and they are also very rich in good fat, high fiber, so you can mix between both. So eat 3 meals a day if possible, and a snack. This is something that is more optional. This way you can reach your protein amount that you need. The second thing is try to never miss a meal. When you miss a meal, the problem is you have lower chance of getting all the proteins that you need on a daily basis. You have enough protein in each meal, around 30 to 20 to 30 grams. This figure can clearly show you how much proteins you have and 100 gram of portion. And you can get this protein. Usually we tend to eat very less proteins in the morning, even lesser on lunchtime, and then at night we eat a lot of protein. So try to balance it throughout the day. This is another major point that I always suggest. Try to balance the protein throughout the day, and this is very important. Have animal source of protein 3 times a week if possible, because animal source of protein compared to plant protein, they are better absorbed. Okay, this is the only thing that we know, is that plant protein are very, very good, very rich in fibers, very rich in oils, good oils. The animal protein is better absorbed when we want to maintain muscle mass. Have fish twice a week, again, another source of high protein, and eat in the hour that follows exercise. If you have this chance of going out and do some exercise, when you come back home, if you can eat within this window, this is how you can actually maximize what you eat as protein absorption. Social contacts. When we talk about social contacts, we talk about spending social time with others can improve mood, reduce risk of depression, anxiety, and mental health problem. This is why sometimes when we go to a residence and we try to get isolated and stay in our rooms, this is a very major problem because we increase the risk of depression, we have higher anxiety rates, and of course, mental health problems. Social connection can also improve brain performance, including memory, and lower your risk of developing dementia. So again, social contacts, always try to think about it as a source of reducing the risk of cognitive decline. And having someone you can confide and reduce your risk of stress-related illness for the long term. Now, tips to get started: call a friend for coffee or get out for a walk together. Sometimes we just don't do it. Take the phone, call the person, go for a walk. Keep it small and simple. It is the best way to set your goal you can achieve. So try to keep this as a habit. Let's grab coffee every Tuesday. Let's grab coffee every Wednesday, or let's do it twice a week. Get to know an acquaintance a little better. Okay, so very important. There are likely people you cross path with regularly, but you don't know very well. So whenever you meet people around you in a residence or in your neighborhood, just talk to them. Talk to them and get to know them. Challenge yourself to say yes. Sometimes we are sitting and we're like, I'm not feeling it today. So try to say yes. Let's go. Let's be involved in something. So say yes if invited somewhere out, a book club, a dance club, a game night. All of these things. Try, instead of saying the next time you get invited, even if you're tired, just say yes. And trust me, whenever you do it, the more you do it, the better it becomes. And be curious. Invite yourself to try a hobby, a new interest. Consider trying out a group. So check out local community listings, free activities in the paper or online. There's so many activities. Just the Safe Seniors, what we do, we go outside. We are all around Quebec and even outside of Quebec. And this is why it's very important to look at all of these free activities and get involved as much as possible. Sleep. When you talk about sleep, it is the most of us struggle with falling asleep or staying asleep at least some of the time. And under stress or mood changes, sleep can be more difficult. And of course, as we get older, it is normal to need less sleep, but sometimes we need help. Okay. And what are these points that could actually help you during the day to fall asleep at night? So daytime exercise. Again, exercise is again another great way of helping you falling asleep when you are at night. Avoid napping or short naps during the day. Of course, when you are during the day, sometimes you feel more tired or you're used to get these naps. Try to avoid these naps. It helps you, especially when you have problems sleeping at night. It helps to fall asleep faster at night. Um, Only early daytime use caffeine, nicotine, or other stimulants. Sometimes we take coffee very late and it could affect us. Now, some people doesn't have the same effect of coffee on them, and this is okay. If you take your cup of coffee and you sleep, it's okay. You can keep taking this cup of coffee. The problem is sometimes we have difficulty sleeping, but we drink 5 cups of coffee and the last one is around like 6 p.m. Of course, it becomes more difficult to fall asleep. Medication, take during the day if they disrupt sleep. So sometimes some medication, of course, talk to your doctor to make sure that it's okay to take your medication during the day, but some of them could disrupt the sleep. When you are in bed, be quiet in a dark room. Of course, it helps. Earplugs and mask if needed. A comfortable temperature, not too cold, not too hot. Try to find a temperature that you feel comfortable with. A calm environment. Avoid thoughts that keeps you awake so many times. We stay awake and we think about all of these negative thoughts. Try to get rid of these thoughts and think about something that could bring you joy to help you fall asleep. Leave after 15-20 minutes if you're not asleep. This is very important. If you feel that you cannot sleep in your environment, just stand up, go for a walk, and come back. And if you have another option of sleeping somewhere else, try it, because sometimes it's the environment that makes it a little bit more difficult. Prepare for relaxing sleep, reading, stretching, or even meditating. This is something that helps. Avoid screen time. If you have an iPad or a phone, try to avoid it, especially younger individuals. They do it more often, but some of the people that I see in residence, they have access to iPads and they have their own iPads or TV or computer. Try to avoid screen time. Working through your thoughts and worries. This is something that is very important. Only return to bed when feeling sleepy. So don't return to bed if you're not feeling sleepy. Just walk around, try to be thinking of something else, try to read, try to stretch, try to meditate, and then go back to sleep.
Do we need more or less sleep as we age? What does the research show? And then part two is, what if I've always functioned on 4 to 6 hours of sleep a night? Like, is that okay, or should I be trying to get more sleep?
So evidence, when I talk about the studies from the literature, we can see that usually older adults tends to sleep less hours.
Okay.
And it doesn't mean that we need more or less. This is every person functions in a specific way. Now, your needs, if what you need is how you feel the next day. And I always say it's very individual. So don't just look at how much I need. I need 7, then I'll do 7. Because there's no specific time that how many hours that can actually give a number of, oh, did I recover well or not? Well, how do you feel? So if you feel well sleeping 6 hours, just do it. And if you feel well sleeping 8 or 9 hours, do it. So it's just how you feel after your night of sleep. The last point is medication. So we talk about influenza, pneumococcal, tetanus, shingles, and COVID. All of these are very, very important. And of course, talk to your medical doctor, talk to your physician, and they will be able to help you and guide you through all of this. The prevention of dementia, again, we have so many people living with dementia. I told you before about how we can prevent it and how we can actually improve our dementia state. 6 ways to reduce the risk of dementia. The first one is treat hypertension. If you are hypertensive, if you have blood pressure machine, take it every day in the morning and look at your blood pressure. If your blood pressure is high, try to talk to your doctor. Try to reduce it as soon as possible. And this is because it increases the risk of dementia. Continue your education. Education maintains an individual's cognitive reserve. If you have courses, if you want to learn a new language, if you want to read, keep doing this. This is very important. Get regular physical activity. I already discussed this during the presentation. It's very important for decreasing the risk of dementia. Maintain social engagement. This is another major factor that actually helps. Reduce or eliminate smoking. Smoking, another risk factor of dementia. And of course, manage other conditions. So chronic conditions like hearing loss, depression, diabetes, all of these could actually increase the risk of dementia and affect your lifestyle habits, which is increasing the risk of isolation. Fall prevention, I think everything that I discussed during the presentation are linked to falls. And what I want you to remember is when you improve your activity states, you directly decrease your risk of falls. What is one of the most common risk factors for falls in older adults? There's so many risk factors, but one of the major ones is muscle weakness. And muscle weakness is a major problem, not just for falls, but for other problems too. But it's very important to understand that if you have weak muscles, you will have higher chances of falls. And of course, if you have fallen in the last year, you have a higher risk of falling again. But if you increase your muscle mass and you have stronger muscles and stronger bones, your risk will be reduced and could go low as 0%. And when we talk about falls prevention, we're talking about so many people with high risk of falls. We talk about 24% of emergency room visits, and it's the sixth leading cause of death. So this is why we have to prevent these falls. If we look at how to prevent these falls, so we look at these two circles that are actually following each other. So when we have an impaired balance, we have this fall, we have reduced mobility, we have loss of ADL disability, and of course it affects frailty, so we decrease activity. So try to cut it by having a better nutrition. Try to cut it by increasing your level of activity. Try to cut it by having more social activities. And why is it important to do this? Because the problem is so many people are close to the dependent line. And then when they have this fall or any kind of illness, they are now dependent. And some of them couldn't actually go back and reach the level of independence. So this is why I want you to be mindful and exercise and eat well and have a healthy lifestyle habit to try to maintain it. So if something happened, a minor illness, urinary infection, or something else, or even a fall that could be a major, you can actually go back and stay in this independent part of your life where you can still keep doing all of your activities and enjoy a healthy and nice lifestyle. So walk and talk is the last tip that I want to tell you is try to do this exercise. If you are walking and talking with your friend, this is one of the major and most important point that you have to work on. If you can walk at the same pace without stopping your walk and continue your conversation and think at the same time, this is a great indicator of health. And if you can't, work on it. Try to go for coffee, try to go for a walk, and even the social activities, don't always do it seated. Try to do it while walking. And this is a very, very important tips that I'm giving you now. It's walking and talking is one of the most important thing that you can work on. Try to not do it all the social activities sitting. Try to do it while doing the exercise. In conclusion, it's of course there's an abundant literature on risk factors of cognitive decline, justifying a preventive approach. Several risk factors are modifiable. So adopt a beneficial lifestyle for health, of course. Healthy eating habits, remain physically active, participate in social activity and sleep, avoidance of detrimental factors such as smoking, inactivity, alcohol, and of course, control your vascular risk, which is hypertension, cholesterol, and diabetes. I'm gonna end our discussion talking about our SAFE program. So SAFE program is a website that you can access it. It's in French or English. The SAFE website is for free. You can go into all of these sections. So SAFE recommendations, resources, and frequently asked questions. And of course, if you go to helpful resources, you can look at all of these sections that we developed. You can look at SAFE recommendations, so exercise recommendations, depending on what your state is, and frequently asked questions that we received throughout our practice within the last 15 years. And of course, if you want to start exercising, you can always click on start exercising or even slide at the bottom of the screen and you can find it and you get to these levels. So you have level 1, 2, 3, and 4. And in each level, you have warm-up, strength, balance, flexibility, and endurance. And depending on your level, This is more for people that have difficulties and moving. So it might be very easy for some of you, but if you have difficulties walking around or starting at a very low point, this exercise is for you, and you can use it and use the level that you think is suitable for you. And I'm just going to share with you some of the photos that I had during my years doing research. I did my first 10 kilometers with this participant. He never ran before. This participant was ended the study with 12 weeks of exercise, lifting over 25 pounds in each hand. Participants over the age of 75 doing push-ups, running marathons, and of course participants that were so strong that even after this session, this is not built within 2-3 weeks. It takes years, but of course if you do it on a regular basis, you can definitely reach higher muscle mass and better independence and lifestyle with aging. This is just to tell you that at any age you can start exercising and you can improve your health without being stopped by any barriers. And all these barriers are can be adapted, and exercise can be adapted depending on your situation. I want to thank you for listening today. And if you have any questions, we can discuss it at the end, or even you can email me and I'll be more than happy to respond to all of your questions. Thank you.
And I just want to thank you for a very inspiring and motivating presentation. I think it's very empowering to think about the things that we can do, you know. And I'm sure we are going to invite you back for a future presentation if you're open to it. Thanks for the great resource and for dedicating your career to creating this resource that's available for free for all of us.
Thank you very much. I think one last tip I would say, start exercising at any age. You will see beneficial effects.
Mm,
That's it.
yeah,
And exercise,
doing something is better than doing nothing, right?
that's it. That's it. And you will always see improvement. Just be patient. We
Okay.
stop too early and we don't see these
Mm.
effects. So that's it. And thank you very much for being here. And I was very, very happy to give this talk.
Okay, thank you so much. And everyone else, will see you the third Wednesday of November for our next session. Take care and happy Halloween, which is coming up soon.